Welcome to this clinical presentation. Beyond the 15-month paradigm, we present a 5-year glioblastoma remission journey.
The baseline: a 68-year-old male diagnosed with IDH wild-type glioblastoma. Standard care includes surgery, radiation, and chemotherapy.
The 15-month limit. Glioblastoma is the most fatal brain tumor in adults. Average survival is approximately 15 months with standard care. The anomaly. This patient achieved 5 years of progression-free survival. We integrated constitutional medicine into his recovery plan. Defining the pathology. IDH wild-type glioblastoma is aggressive. Our focus is squarely on this severe type, not the more responsive mutants. The toxicity barrier. The patient, a high-level official, faced a choice. Standard chemotherapy triggered debilitating nausea and extreme fatigue. The breaking point. Within 1 month of Temodol protocol, he experienced physical collapse. He chose his purpose over standard medication. Treatment for ailment fork. Standard care was abandoned due to intolerable toxicity. He adopted a proprietary herbal monotherapy in March 2021. The pivot to monotherapy. He transitioned to MSC 0500 decoction. We optimized his circulation by adjusting cardiovascular medications. Dual-axis clinical journey map. Despite terrifying MRI spikes over 5 years, tissue cultures proved 0 tumor cells were present. Phase 1. Surgical baseline in August 2020. Gross total removal was confirmed, followed by a clean postoperative bed. Visual evidence from 2020. Initial scans showed no contrast-enhancing lesions, marking the start of his progression-free journey. Clear margins to equivocal growth. In March 2021, a small 0.9 centimeter nodule appeared, triggering clinical anxiety. The first false alarm. Recurrence was feared. However, the first open brain biopsy confirmed only reactive gliosis and inflammation. Ongoing monitoring. Scans from 2021 to 2024 show the evolution of the treated site without tumor recurrence. The diagnostic trap of radiation necrosis. MRI showed dramatic growth to 1.6 centimeters. Radiologists flagged this as progressive disease. The deepening mystery. Doctors were certain of recurrence due to massive enhancement. A third craniotomy was performed in June 2023. The diagnostic illusion. The tissue was merely showing a powerful immune response. The immune cleanup crew was mimicking a tumor. Imaging versus pathology. MRI contrast enhancement is an unreliable narrator. 0 viable glioblastoma cells were identified in tissue cultures. Long-term visual resolution. Following the peak inflammation, the irregular enhancing lesions began a natural regression process. From peak inflammation to resolution, the third craniotomy confirmed pure inflammation. By 2025, measurable enhancement disappeared. Resolution and remission. In October 2025, the site remained completely stable. The patient reached the 5-year tumor-free milestone. 5 years later, mission accomplished. He completed his government term with cognitive faculties intact, retiring normally and tumor-free. Synthesis and mechanism. This success is supported by research from Dr. Guiming Lai at Taipei Medical University. The herbal compound MSC 0500 inhibits glioblastoma stem cells and restores immunological homeostasis. Achieving 5-year survival is a rare outcome, representing only 3% of cases. This case demonstrates the potential of constitution-specific therapy in isolating and managing terminal disease naturally.